Hi folks, thanks for watching my monologue. As you may have heard, there's been a recent run on guns and ammunition. I just wanted to let you know that Guns Etc. is in a 10,200 square foot building which holds a lot of guns. So Guns Etc. is open and has a lot of product. Or you can go to gunsetcetera.com, that's gunsetc.com. And if you like my monologue, please subscribe to our channel using 960 The Patriot. Welcome back and happy April 15th, 2020. Today, Bill Bennett and I had an op-ed published at Real Clear Politics. I'd ask if you don't mind reading it, realclearpolitics.com. The most major pushback we received was along the lines of, "You are irresponsible. This is nothing like the annual flu. This is much worse, orders of magnitude worse than the flu." Okay, I'm open to that possibility. I've crunched as many numbers as I know how. So what am I missing? Let me give you what I see, and you tell me what I'm missing. There are, as of now, about 133,000 deaths from COVID-19 around the entire world. That's the world death count, 133,000. We've been at this since January, so about 4 months. The World Health Organization estimates that the flu kills between 290,000 and 650,000 people per year across the world. Today, to remind, world COVID-19 deaths, 130,000. Annual flu deaths, low end 290,000, high end 650,000. So as of now, we are about 157,000 less deaths than the flu on a good year. We are 500 less deaths than the annual flu on a bad year. In America, we are less than 28,000 deaths from COVID-19 as of right now. The most recent projections say we'll get to 68,000 or so deaths. We've seen flu deaths in America range in any given season from about 24,000 to 61,000, given the confidence intervals could be much higher. By the way, that's with a vaccine. We have needed some 65,000 hospitalizations in America for the coronavirus. We need hundreds of thousands of hospitalizations for the flu every year. Are we to believe we are going to approach anything like this? Heck, sitting at 28,000 deaths from COVID-19 right now, does anyone rationally see how that number is to double or triple from where we are currently? Especially, as most have said, we've now passed the peak? Again, if I'm missing something, I'm open to it. But of course we are told, well, it is the mitigation factors that have kept the numbers low. Maybe. In some cases, sure. Maybe not. Let's compare a couple of things. In the state of New York, their stay-at-home order took effect on March 22nd. They have 1,031 cases per 100,000 people, 55 deaths per 100,000 people. Those are what we call per capita rates. So again, in New York, 1,031 cases, 55 deaths per 100,000. Now let's go to Florida. They didn't have a stay-at-home order until April 3rd. What is their per capita rate? In Florida, it's 105 cases per capita, and it's 3 deaths per 100K. Florida, which waited 2 weeks longer than New York to have a stay-at-home order, is 10 times less the magnitude of infections than New York per capita. The death rate in Florida per capita is 18 times less than New York. So, do the orders solve the riddle? Some more draconian, some less. Have they kept this from being less than the annual flu? I don't know. There's data both ways, but it certainly isn't a certainty. Isaac Ben Israel is the chairman of the Israeli Space Agency and the National Council for Research and Development, as well as the head of the Security Study Program at Tel Aviv University. Here's what his analysis finds. Quote, "The incidence of patients was greater here by the day. There was an increase in the first 4 weeks after the epidemic was discovered. As of the 6th week, the increase in the number of patients has been moderate, peaking in the 6th week at 700 patients per day. Since then, it has been declining, and today there are only 300 new patients. In 2 weeks, it will reach 0, and there will be no more new patients." Now get this. Here's the key statement. Quote, This is how it is all over the world, both in countries where they have taken closure steps like Italy and in countries that have not had closures like Taiwan or Singapore. In such and such countries, there is an increase until the 4th to 6th week, and immediately thereafter, moderation until during the 8th week, it disappears. Close quote. He goes on. Pay attention. Quoting again. This is happening both in countries that have closed down, like us, and in those that have not closed, until today, like Sweden. Every country, no matter its response, the decline and rise occur according to the same timeline. Close quote. He adds, quote, "It's clear to us how the epidemic is starting and what is causing the increase. What is causing the moderation is unclear." Close quote. Keep in mind, too, the model we as a country shifted to using, from the hysterical Imperial College model predicting 2 million deaths, here to the more rational Institute for Health Metrics and Evaluation, the IMHE. They gave us numbers as high as 240,000 a couple of weeks ago, before generally settling now at about 69,000 deaths projected in America, with a low estimate of 30,000. You don't ever hear about that. And guess what? All their models, from the 240,000 to the now 69,000, assumed mitigation and social distancing orders. I know data is not the plural of anecdote, but I did speak to one physician today, a medical doctor, and I asked him, "What do you say when people tell you this is worse than the flu?" He said, and I quote, "There is nothing I've seen that backs that up. And the more I see numbers thrown around predicting how bad this can be, either with or without distancing, the more it seems to me people are just making it up." Close quote. Now, he knows there are sophisticated modelings, but his point is there is no way to trust the worst-case scenarios, and perhaps even the middle-case scenarios, because they've not just been wrong, they've been wrong by a lot. Now, let me not take a back seat to my critics who want to virtue and health signal me as being irresponsible when I talk about comparisons to the flu. I simply won't have it. For 20 or more years, I've been talking about and warning about all kinds of health risks, especially for our youth. Hell, tell me who has spoken more about the 60 to 70,000 deaths each year due to drug overdoses. There probably are 15 or so Americans who have written or spoken more on it than I have, but not more than that, I don't think. I won't take a back seat to anyone in being told I don't care about our public health, which is why I care so much about what we are doing about something that looks so much like, if not a little less, than the common annual flu. Obviously, before I go on, let me not be mistaken. Of course, we should all be careful when a new virus or any virus stalks us. Of course, we should wash our hands more and be more careful, especially our vulnerable populations in our more vulnerable locations. 70-year-olds in New York City need to be more careful and taken better care of regarding this than the rest of us, and certainly more so than 17-year-olds in, I don't know, let's say Phoenix. And this is my concern. What we are doing about the coronavirus will give us a second pandemic, especially with our youth, that is much more and much worse than the coronavirus. Try this on for size. Our nation's schools were among the first institutions to close. That was and is a damned big deal. It immediately changed over 55 million children's daily lives. Disrupting children's lives, disrupting families' lives, upsetting education to be sure, but also the kids' social networks and the way they lived. Look at how this virus affects children. It doesn't. New York City shows a total of 3, not 3%, a total of 3 deaths from COVID-19 of those aged 17 and younger. Those 3 all had underlying conditions as well. So to try and protect our most vulnerable population, we upended their lives for a disease that will not touch them. How will that play out? Anyone remember the concern that our schools are often the only places some, even vast numbers of children will get a meal, or an adult, or a hot meal, or a serious presence in their lives? How many children does this affect at these worst-case meal and adult data? Data is hard to come by precisely, but a minimum, 3 million. 3 million children. Now, throw in unemployment with this effort. 17 million jobs lost. Many more expected. probably in the 20 million range. Now add this. Think about people in sobriety from drugs and alcohol. Majorly devastating lifestyles that take a lot of life. Well, guess what? Recovery meetings are now gone. Dr. Tim Brennan, director of the Addiction Institute at Mount Sinai West in New York, said this, quote, "I'm hard-pressed to think of a bigger relapse trigger than what we're going through now as a country," close quote. Now add this, quoting the Wall Street Journal, quote, "The economic and social science literature is replete with studies that document the harm to people from recessions and economic hardship, including higher rates of suicide, opioid abuse, alcoholism, and domestic violence." We have the data supporting this. It's not good. That's why I and others are concerned about a second wave of this pandemic, the wave that will include mental and physical health as a result of turning the country upside down. So no, I don't need lectures on being irresponsible or callous. But neither am I invested in crisis and frenzy and panic, which leads to worse problems than the chimera created by a complex of media and politicians that are invested in those things. Let's roll up our sleeves and see how we can get back to work and get back to health, all our health, mental, physical, all ages. For as C.S. Lewis once warned, when there's a flood, you don't bring the fire hoses. And when there's a fire, you don't bring on the bellows. I'm Seth Leibsohn. We'll be right back.